Welcome to TPMG Health Talk. Join us for valuable insights and practical advice on health topics that matter to you most, delivered by our top medical professionals. At Tidewater Physicians Multi-Specialty Group, we're dedicated to providing high-quality, physician-directed care to the Hampton Roads community. Subscribe now and visit mytpmg.com for more resources. Now let's dive into today's episode. Today, we're excited to welcome Dr. Guina, a neurologist with over 20 years of experience, to the podcast. As part of the TPMG Neurology team at Williamsburg, Dr. Guina is highly skilled in treating a wide range of neurological conditions, and we're thrilled to have her here to share her expertise. Thank you for being here, Dr. Guina.
I'm happy to be here.
Neurology is a vast field covering everything from common headaches to complex movement disorders. To start, could you give a broad overview of what neurology encompasses and what are some of the most common neurological conditions you treat?
So the nervous system is what the neurologist takes care of. So you start with the central nervous system, which involves the brain and the spinal cord. There's the peripheral nervous system, which involves the nerves that control sensation, strength. And then there's the autonomic nervous system, which is quite all-encompassing as it controls automatic functions of the heart, your gastrointestinal system, your respiration, your vascular system, or your circulatory system. So you could say that the neurologists are all over.
Yeah, for sure.
Yes. So the conditions that we treat most commonly as an adult neurologist, you would have the headaches, as you mentioned. Migraines are quite typical, cluster headaches, the tension type headaches. Then there's the epilepsy with the seizures in its various forms, strokes, the problems with memory, which can range from Alzheimer's disease, the Lewy body dementia, vascular dementia, and then there are other problems relating to the autonomic nervous system wherein people have dysfunction, which can range from problems with keeping their blood pressure up or having problems with passing out because of the autonomic problems. And then you have other issues with the muscles. So that would include weakness, some cramping, and then the nerve disorders. We have quite a large range of nerve diseases which fall under a big umbrella of neuropathy, which can manifest in many ways.
Needless to say, there's never a dull moment at the office.
That is very true.
Well, what are some key signs or red flags people should be aware of that would signal it's time to consult with a neurologist?
So commonly, the headaches that are hard to control, that are frequent, or if you have what are called focal neurologic deficits. So, for example, if you're having problems with your vision with your headaches, if you're having problems with speaking, if you are having some numbness, and then the problems with memory, and then the problems with balance, strength. Those are the common symptoms. So what we call focal neurologic deficits or absence or a reduction of nervous system function.
Okay. Well, we mentioned headaches, and as someone who experiences them often, I can definitely relate to how disruptive they can be. Chronic migraines in particular are not just a headache, they can significantly impact daily life. So what are some treatment options available for managing chronic migraines?
There are some people that can downplay headaches or migraines, but it certainly can be disabling and it can affect a person's quality of life. So I understand the need to look into different kinds of treatments. The way we treat migraines or headaches are in two ways. One would be the abortive therapy, which are the medications or therapies to take when you have the headache to try and abort or stop the headache. And then the other class would be the preventive medications. And those are usually daily or monthly medications to cut back on how often the headaches are, reduce the severity, reduce the frequency, and eventually reach headache free status. Obviously, trying to find the right balance between achieving the goals of becoming headache free with minimal side effects. So, as far as the preventive medications, they fall under different categories. The categories can include blood pressure medications. Second group would be antidepressants. Third group would be anti seizure medications. And then there are supplements such as riboflavin and magnesium. And then there are medical devices such as neurostimulators, some that are in the form of a headband. Then there are some that are cell phone based that are attached to an arm, and then some that are a vagal nerve stimulator.
To help migraines?
Yes.
Wow.
So these are different medical devices. And then there's another category of preventive medications. They fall under a class called CGRP blockers. Some of them are monthly injections. There are some that are daily tablets, and there are some that are both can act as an abortive medication as well as an every other day preventive medication. And then there are some that are an every 3-month infusion.
Wow. I legitimately had no idea there were this many options.
And then there's also botulinum toxin therapy for migraine prevention for chronic migraines.
Wow. Out of all of those treatments, what would you say is like the most common treatment?
Oftentimes, because there's a dearth of medical specialists in the country, our very able primary care physicians have tried the antidepressants, anti-seizure medications, and the antihypertensives. So by the time they get to a neurologist, then you end up using the other therapies. So I guess it's by nature of where they are in their stage of care that I end up seeing that a lot of people are already in the CGRP blockers and the Botox therapy.
Well, a key area of your expertise is movement disorders. For our listeners who may not be familiar, can you explain what a movement disorder is and give us some overview of what common conditions you would treat, like dystonia or tremors? You mentioned those.
So movement disorders are disorders that you have involuntary excessive movement or a lack of movement. So the more excessive movements are usually the ones that are primarily referred to as the movement disorders. So the excessive movements would be in the dystonias, the chorea bulismus. Those that have less movement can include those that have Parkinson's, wherein they have a reduced movement. Kinesia is the root word for movement. So bradykinesia means it's a reduced movement. So that's one of the things we see in Parkinson's. So you had mentioned dystonia. Their tone is the passive quality of range of motion of a limb or a part of the body. So DYS, this means that there's a dysfunction in the tone. So the disorders that we see include excessive blinking in the eyes, which would be blepharospasm. Then there are people who have excessive spasms in one side of the face, which you would classify as hemifacial spasm. And then there are other people who have cervical dystonia. The other name is spasmodic torticollis, wherein people have either a twisting of the neck or a forced flexion or bending of the neck. And that can also happen in other parts of the body, including an arm or the trunk or the leg. So there's different manifestations.
Right. So everything in the body is connected to the brain. It's such a powerful way to think about how our health works. And it really makes me curious to hear from your perspective. As a neurologist here at TPMG, what do you enjoy most about practicing in such a comprehensive field? What do you love about being a neurologist with us?
My favorite part of being a neurologist in TPMG is just welcoming every day and being prepared to make a difference in someone's care, trying to help them become better than when they first came to me.
Yeah.
I think that's one of the most rewarding things about this line of work.
I love that. Do you have a success story that you could share with us?
Neurology is a very complex field. Our highs and our lows are not only based on improvement of a patient's neurological status, there are some people that just require care. One of the earliest memories I have was going through medical school and deciding neurology as my field of specialty, and people would ask, why would you do that? What is very rewarding is seeing the evolution of medications, treatment, therapy that we can offer our patients over my career. But still, the care is still an overlying factor that guides the treatment. So the best days of my week may not always be, oh, this person's cervical dystonia has improved greatly, that their neck pain is better, that they can move their head better, they're more functional. But it can also be how my care has made a difference in educating a person regarding their diagnosis and helping them cope with it. Our perception is surgery, you take something out. We don't necessarily do that because do think that neurology involves a lot of care. As you say, there's no dull moment.
Yeah.
Yes.
Oh my gosh, for sure. Well, on that note, are there any emerging trends of new advancements in neurology that you're particularly excited about?
A lot of evolution in the medications is certainly very exciting. I am subspecialty trained in epilepsy, and it is fascinating how not just more medication, but neurostimulation has been very helpful. And in that light, I am also passionate about the health of women. So I'm heavily involved in preparing them for their plans to start a family as they go through the difficulties that they can have with epilepsy, even with migraines.
Right. And epilepsy affects both men and women.
Yes.
Can you discuss how epilepsy affects women differently than men and why it's important to have specialized care when treating female patients?
Epilepsy care is multifaceted. The common notion is that you just have to control a person's seizures, and that constitutes epilepsy care. But a person with epilepsy can also deal with the mental health concerns. Medications can affect their bone health, and medications can also affect their other organs. So it can affect mental health. It impacts their function in society. It can impact their decision as far as their career. Are they going to get married? What kind of plans are they going to be able to socialize? So the supplements that they take can impact their epilepsy. Their driving is a big factor in the control of their epilepsy. Are they on the right medication? Is this the appropriate medication if they plan to start a family? The neurodevelopment of their children, how is that going to turn out? So yes, the men have needs that are unique to them. The women also have unique facet to their care, which includes, the different reproductive stages, the hormonal states, the hormonal influences. Bone health is an issue for both genders, the fertility issues. So there's so many aspects to it.
Well, Dr. Guina, you offer a number of in-office procedures and diagnostic tests, including EEGs, EMGs, and nerve blocks. Could you walk us through what some of these procedures are and how they can help diagnose or treat neurological conditions?
So in the office, we have diagnostic and we have therapeutic procedures. So as far as diagnosis, we have the EEG, which stands for electroencephalogram. It is checking on a person's brain waves. So it has different applications. So for people with epilepsy, you are trying to figure out where are their seizures coming from. Are there signs of irritability in their brain? And then there are people with memory problems, and you're trying to make sure that their memory problems are not because of little seizures that they are having, that their external manifestations are just forgetting. And then there are some other manifestations or neurologic symptoms that you're trying to make sure that they are not representative of epilepsy. So that's one of the, those are some of the applications of the EEG or electroencephalogram. The second diagnostic procedure that we do in the office is the EMG, which is representative of electromyography. The second part of that test is nerve conduction velocity testing. We usually omit the nerve conduction velocity testing, and we just simplify it by saying EMG. So it's a two-part test. The first part involves use of little shocks, like how it feels when you hit your funny bone. You're trying to see how the nerves are sending messages. Are the responses appropriate? Is it slowed down, or is there a choke point somewhere in the nerve highway? The second part that's the electromyography, which involves a small needle that is inserted in different muscles depending on the reasons for which the test is ordered. These are diagnostic tests to check on nerve and muscle problems.
How long are these tests usually?
The EEG would be about an hour appointment, and then the EMG nerve conduction would be about a 40-minute appointment.
Good to know. And before we finish, do you have any final advice on how people can stay proactive when it comes to their neurological well-being?
For brain health, it's very important to really take care of yourself. Being involved in mentally challenging activities on a daily basis, being involved with physically challenging activities, including aerobic activities that increase your heart rate. The goal would be greater than 150 minutes per week. The socialization, good sleep health, avoiding exposure to toxic substances, which would include nicotine, moderate amount of alcohol, avoiding pollution. So these are some of the known problems that can increase your risk for memory issues. Obviously, wearing protective equipment when necessary. So using a bike helmet when you're riding a bike, including e-bikes, and eating well. So less processed food. The data is suggesting the MIND diet, which is a combination of a Mediterranean diet as well as the DASH diet for controlling blood pressure. These are all things that I would highly recommend, and maybe you won't need to see a neurologist, but if you do, we're here.
Little things to help.
Yes.
But yes, thank you for being here. I know we covered a lot. Any final thoughts you'd like to give the audience?
I guess focal neurologic deficits, and if it's sudden, I cannot overemphasize, if you have stroke-like symptoms, do not wait for an appointment. Call 911 and get to the emergency room. Time is brain.
Ooh, Ooh, absolutely. Yes. Thank you so much, Dr. Guina, for sharing your expertise with us today. We hope this episode has provided just a little bit of insight into the world of neurology since there's so much. Thank you, listeners, for tuning in to TPMG Health Talk. For more information or to ask questions, visit mytpmg.com. Stay tuned for our next episode. Take care.